Yeah. So, Steve, you were just asking if there are sex differences in kind of nutrition and dietary changes. That was your question?
Yes, as it applies to AS.
Yeah, I don't know of any. I will say that in general, there are more studies coming out in the rheumatology field showing that having a plant-based diet or an anti-inflammatory diet does really help control rheumatic conditions. I think most of the data is in rheumatoid arthritis. So they've done studies where they will randomize some people to like a plant-based diet and other people have usual diet, and they find that people who eat more plant-based, have less processed foods, less sugar, less meat, those people are able to lower markers of inflammation, and get better disease control. So we tell people, if you want to try a plant-based diet or a Mediterranean diet, it can really help. I'm not familiar with any differences by sex, though, but I think that's
Mhm.
interesting.
Okay, thanks.
Yeah.
If I may, I've got one kind of observation, and being somebody who's had this for a really long time, I've seen such a world of change in the whole medical approach to AS. And originally, when we started, I was really early in the game, and they said, "Okay, listen, you got this problem, take NSAIDs,
Mm, mhm.
and hopefully that'll keep you moving and all that." And then pretty soon, years later, came biologics, and they offered more. And what I love to see now is I love to see the younger rheumatologist doctors are saying, no, let's look at this. There's more to the equation than just take this drug and I'll see you next month. There's
Yeah.
more to this equation, and that is this. It
Hmm.
is what you're talking about. I think that one of the most important things for me is to understand about movement, about stretching, because it's key. It's key to this. And for a long time, I don't think it was on front page, and now
Yeah.
I do. And it's interesting that Steve asked that question about diet, because that's another one, you know. And the other one that I'm really surprised and happy to see is this can be stressful, this can be painful, this can be depressing, and and let's look at some other therapies like
Mhm.
I think mindfulness, makes sense.
Oh,
This
yeah.
really makes sense. And so my only observation is that I totally am in agreement with you, totally. And I love the program they're using for, exercise and gauging how they're doing and when they're doing it and all that. I think that's really key. So I don't really as much have a question except that it's I'm glad to see it.
Oh,
And
good.
I think it's great. So
That's awesome. Yeah, thank you for the feedback. And I agree with you. I do see more and more studies coming out focused on lifestyle, whether it's on diet. There are some studies in rheumatoid arthritis on mindfulness and seeing how that can lower inflammation too. So I know there's so much more research that's been done in rheumatoid arthritis. I feel like we're trying to catch up in the spondyloarthritis world. They're so ahead of us. So that's why we're trying to get more people and more funding for spondyloarthritis research. So we can do more lifestyle things too.
well, I think it's great.
Awesome.
And thank you.
Yeah, my pleasure. Any other questions or comments? Yeah, Kristen?
Yeah, hi. I'm your patient, so it's nice to see you in this setting. Hello.
Yeah.
I was really interested. I mean, the whole talk was really interesting. Thank you for coming and sharing with us, and I appreciate your work looking at sex differences.
Yeah.
I was really struck by the table you had towards the beginning of your talk that looked at the differences in that the review you did, the literature
Mhm.
review, uh, showing that what looked to me like it may be more difficult to diagnose women if their C-reactive protein is often normal, if it's not showing up on X-ray as much as we like, or which was those are both true for me as well as I also as well.
Mhm.
So I wonder, like, is there any work on when women or females don't have the what are seen as the telltale signs of this disease when they don't have it? How are diagnoses made? Because I think that may
Yeah,
perhaps play into why it takes so long. It took, I think, a very long time for me to get diagnosed and sent to rheumatology. So
totally.
I don't know if you could talk a little bit about like what is the research community doing to help women not fall through the cracks?
Yeah, totally. That's a great question. I guess I'll step back and say what's so hard is that 1 in 5 people in the United States has chronic back pain. And that's a huge number, right? 20% of the US population has back pain. 5% of people have what we call inflammatory back pain. So I think this is where primary care doctors should kind of like perk up their ears a little bit. So we can ask people questions about their back pain. We can say, how old were you when it started? Spondyloarthritis is more likely if someone says, yeah, I was younger than 40 when it started, right? Or younger than 45. If you say, do you remember something that caused the back pain? Like, did it come on suddenly or did it come on really gradually? In spondyloarthritis, it's more common to be gradual. People with spondyloarthritis tend to say exercise makes me feel better, makes me feel less stiff. But if I sit a lot or if I don't move, then like the pain gets worse, actually. Or, people say like NSAIDs help. And so asking those kind of inflammatory back pain features, I think should be the first step towards, thinking, oh, so many people have back pain, but only 1% of people have spondyloarthritis. So who is that 1%? How do we find them? Go to the 5% who have inflammatory back pain, get those questions down, and you can say, oh, they have inflammatory back pain. Then from there, you get the x-ray of the pelvis. And what I try to teach the fellows is that if the x-ray is normal, you don't stop there because you've already committed, you've already said, I think this person could have spondyloarthritis. So no matter what the CRP is or the HLA-B27, you should get the MRI. And so then the MRI should really help. And so then the diagnosis is really based off of the clinical symptoms, the physical exam, the blood tests, and all the imaging. And then the rheumatologist can kind of put it all together. So I think I'm hoping like in the next year or so that Spartan is going to come out with this recommendation for referral to rheumatology to be evaluated for spondyloarthritis. And I have seen review articles out there for primary care that kind of go into that. But we're still like in a phase where we need to agree on what constitutes a referral to rheumatology and kind of like implement that and send that to the primary care doctors. And it's really hard for them, right? Because in primary care, you see everything. So I was a primary care doctor before I was a rheumatologist, right? I had to go through residency in internal medicine and get board certified. And I just remember, all day you're seeing people with totally different conditions. So it's so hard. So yeah, they need support, right? And so it's like, how can we make it as easy for them as possible? But I hope that now, because we know that the MRI is helpful, and we're kind of defining like what is a positive MRI for spondyloarthritis, that hopefully it won't be as much of an issue. Like more people will get the MRI after the X-ray and then there'll be more answers. So I hope that answers your question.
And I think too, maybe, more education for primary care doctors about the peripheral joints that can be involved as well, because I just got bounced around from, foot doctor, shoulder doctor, the sports medicine doctor, hand therapist, all of that, but it was all part of a big picture.
Yeah,
And I think people aren't necessarily, perhaps with women, understanding that all these different joint issues could be part of the same disease along the back pain. So yeah.
totally.
Yeah, really interesting. I really appreciate your talk today.
Yeah. Oh, you're welcome. My pleasure. Yeah, I really hope it'll get better. And I think we're going to move into more precision medicine too, right? Like
Mhm.
it's not just the HLA-B27 gene that's associated with spondyloarthritis, but there's like these polygenic risk scores now where there's many different genes and they all come together to increase the probability of the condition. And so, who knows in the future what kind of blood testing we'll be doing, right? To like figure out what the patient has. Yeah. Any other questions?
I think your discussion is really excellent. And I just got to throw out this one example because I think you're right. When I grew up, my mom always had back pain,
Hmm.
serious back pain. And whenever we had like a big event, it was just so tough for her to handle it. Sometimes she would just leave.
Hmm.
Well, years later, I got properly diagnosed and I looked back and I said, oh my God, I have what she had. But
Hmm.
she never got diagnosed. And when she went to the doctor said, well, of course you have back pain.
Oh,
You got four
yeah,
kids. That's, and there's that part of it. The other part of it, I think is sexism. It's just like,
totally.
yeah, it's just like, yeah, you'll be okay.
Hmm.
And knowing what I know now, she totally had it. And, uh,
Yeah.
and
Gosh.
I love to hear what you're saying about getting primary care smarter about, what are the underlying conditions here.
Yeah.
somebody told me that a good percentage of the people that get finally diagnosed with AS are because they end up with iritis and they go to their eye doctor. And their eye doctor says, "This is when I see this,"
Hmm.
and
Hmm.
then sends them to a rheumatologist. But
Yeah.
what Kristen's talking about, I've just heard too many stories about
Yeah.
that where they go to this doctor. I have a niece that goes to this doctor, this doctor, and none of them has ever put their hands on this.
Yeah.
So, so I couldn't agree more. I think, you know, informing the medical community about, hey, it's out there, it's alive, and we
Hmm.
sure hope you guys can see it
Right.
because it,
100%. And it's, 1 in 100 people have spondyloarthritis. So it's common. It's actually just as common as rheumatoid arthritis, which people get diagnosed with much more easily. But also in rheumatoid arthritis, we have blood tests that point toward the diagnosis much more easily.
exactly.
Yeah. So I think there's a lot of good people working on this topic, a lot of people who are very passionate about improving the delay to diagnosis. So I go to all the spondyloarthritis conferences, so I listen to them all the time.
Cool. Yeah.
Yeah, that's really fun. Oh, any
Well,
other questions or?
great data. Thank you.
Oh, you're welcome. It's my pleasure. It's so nice to meet you all. And Kristen, good to see you.